Hello, everyone, and welcome to the Healthcare and the ADA, including people with disabilities webinar series. I am Pam Williamson from the Southeast ADA Center, along with John Doris from the Northwest ADA Center. We will be your moderators for today's webinar. This series of webinars is brought to you by the Pacific ADA Center on behalf of the ADA National Network. The ADA National Network is made up of 10 regional centers that are federally funded to provide training, technical assistance, and other information as needed on the Americans with Disabilities Act. You can reach your regional ADA center by dialing 1-800 949 4232. Real-time captioning is being provided for this webinar, and the caption screen can be accessed by choosing the closed caption or CC icon in the meeting control toolbar. As always in our sessions, only the speakers will have audio. If you do not have sound capabilities on your computer or prefer to listen by phone, please dial 1-669-900-9128 or 1-646-558-8656. The webinar ID is 832-4113-1487. And please note, this is not a toll-free number. The webinar series is intended to share issues and promising practices in healthcare and accessibility for people with disabilities. The series topics covers physical accessibility, effective communication, and reasonable modification of policy issues under the Americans with Disabilities Act of 1990, also known as the ADA. These webinars occur every other month on the fourth Thursday of the month at 2:30 p.m. Eastern Time, 1:30 p.m. Central Time, 12:30 p.m. Mountain Time, and 11:30 a.m. Pacific Time. By being here with us today, you are on the list to receive notices for future webinars in this series. The notices go out 4 weeks before the next webinar and open that webinar to registration. At the conclusion of today's presentation, there will be an opportunity for everyone to ask questions. You may submit your questions using the chat area within the webinar platform. The speakers and moderators will address them at the end of each section, so feel free to submit them as they come to your mind during the presentation. As a reminder, as you submit questions, type and submit your questions in the chat area text box or press Alt-H and enter text in the chat area. If you are listening by phone and not logged into the webinar, you may ask questions by emailing them to adatech@adapacific.org. If you experience any technical difficulties during the webinar, please send a private chat message to the host by typing in the chat window. Type your comment in the text box and enter on the keyboard. Use Alt-H to access the chat box via the keyboard keys. You may also email adatech@adapacific.org or call 510-831-6714, and that's a voice or relay number. Today's session is titled Enhancing Disability Competent Care Through the Nursing Guide to the Americans with Disabilities Act. Nurses spend more time with patients with disabilities than most other healthcare providers, yet they are often not trained on evidence-based practices for caring for this patient population. In this webinar, Dr. Erin Vinoski Thomas will describe a newly developed training for nursing students intended to improve their knowledge of the Americans with Disabilities Act and best practices for providing disability competent care. Today's speaker, as noted earlier, is Dr. Erin Vinoski Thomas, and she is a research associate professor in the Department of Health and Policy and Behavioral Sciences and the director of the Center for Leadership and Disability, a university center for excellence in developmental disabilities at Georgia State University. She has led CLD's work as the Georgia affiliate for the Southeast ADA Center since 2021. Erin, at this time, I will turn it over to you, and thank you.
Hi, everyone. Thank you so much, Pam, for the introduction and for the opportunity to present this work on behalf of my team at the Center for Leadership and Disability, or the CLD, and our funders and collaborators at the Southeast ADA Center. We'll go on to the next slide, please. Before we get started, I am required to acknowledge the funding that supported the development of this training and my work on this webinar. The contents of this webinar and the training described in the webinar were developed with funding from the Southeast ADA Center under a grant from the National Institute on Disability, Independent Living, and Rehabilitation Research, or NIDLR, which is a center within the Administration for Community Living, or ACL, which is part of the U.S. Department of Health and Human Services, or HHS. The Southeast ADA Center is a project of the Burton Blatt Institute at Syracuse University. The contents of this presentation do not necessarily represent the policy of NIDLR, ACL, or HHS, and you should not assume endorsement by the federal government. We can go on to the next slide, please. So now that we've completed that long-winded requirement, let's review the 3 learning objectives for today's webinar. By the end of this presentation, you will be able to define disability competent care in the context of the nursing profession, explain how the Nursing Guide to the Americans with Disabilities Act, or ADA, training was developed and pilot tested, and describe how to access the training. I am going to start by just discussing some background information and the rationale for developing the training. I'm then going to spend most of today's webinar time talking about how we developed and tested the training to make sure it addresses the needs of its intended learner population. So we can go ahead and go to the next slide. So believe it or not, and contrary to what you may have heard or acknowledged in your own work, there are a lot of trainings that are available for healthcare providers to learn best practices for caring with patients with disabilities. So you're here and you might be wondering, why are we developing yet another training? I'm going to review some background information next that will help you to understand the rationale for developing yet another and this specific training and the gaps that it intends to address. Next slide. One of the most important issues for people with disabilities is being able to get the healthcare they need in their communities. People with disabilities experience persistent inequities in access to healthcare, quality of healthcare received, and health outcomes. And these inequities lead to poorer health and oftentimes a shorter lifespan. People with disabilities are an incredibly diverse population, and yet these inequities persist across disability types. We do know that health inequities are generally more pronounced for people with intellectual and/or developmental disabilities compared to people with other types of disabilities when controlling for age. We also know that compounded disparities, often referred to as the double burden, are experienced by individuals with disabilities who also identify as members of other historically minoritized and underserved groups. Next slide. So according to the National Institutes of Health, it is now fairly widely recognized that inequality and exclusionary structural practices, programs, and policies inhibit access to timely and comprehensive health care, which further results in poorer health outcomes for people with disabilities. And there are numerous systemic barriers that influence these inequities, including our focus for today, which is a real paucity of healthcare providers who are adequately trained to provide disability competent care. Next slide. To ensure we're all on the same page, let's talk about disability competent care. Disability competent care can be defined as participant-centered care that focuses on providing care and supports to maximize function and address barriers to integrated, accessible care for patients with disabilities. Another key point about disability competent care is that it recognizes and treats each patient as a whole person, not as a diagnosis or a condition. The last important point is that disability competent care is typically provided by an interdisciplinary team, which can include physicians, nurses, social workers, therapists, pharmacists, admins, and many others. And oftentimes, nurses are the glue that holds that interdisciplinary team together. So we will talk more about that in a bit. Next slide, please. So revisiting the concept of interdisciplinary healthcare teams. When we think about interdisciplinary healthcare teams, most of us might initially think of an attending physician or a physician who is in charge of clinical care as the head of that team. I probably have many nurses in the audience that might disagree with that, though. Regardless, physicians do have significant authority and power when it comes to provision of care for all patients, including patients with disabilities. Thanks to a study conducted by Lisa Iazzoni and her colleagues that was published in 2022, we have data that tell us about what physicians report knowing about the Americans with Disabilities Act, or the ADA, and closely relatedly, how the ADA relates to their legal responsibilities in caring for patients with disabilities, including providing reasonable accommodations for these patients. And I'm including that specific point about reasonable accommodations here because one of the most important legal responsibilities of healthcare providers in terms of providing disability competent care to patients with disabilities is not just to provide reasonable accommodations, but to plan for those reasonable accommodations ahead of time to ensure that they can be provided in a correct manner. So 714 US physicians participated in this survey. The data show that over 1/3 of the physicians reported knowing little or nothing about their legal responsibilities as defined by the Americans with Disabilities Act, or the ADA. Secondly, over 70% of the physicians that participated in the survey answered incorrectly about who determines reasonable accommodations. And lastly, over 20% of the physicians who completed the survey could not correctly identify the payer, so the person or entity who is responsible for paying for reasonable accommodations that are provided for patients with disabilities. There were other key findings in the study, but these were the three that I really wanted to highlight today because they point out a pretty significant gap in knowledge of the ADA among physicians who, as I already stated, hold a lot of power and authority over how care is provided to all patients, including patients with disabilities. And as I already alluded to, the gap in knowledge around providing reasonable accommodations is really important because it demonstrates that patients' rights under the ADA may not be being consistently met. And this is the key point, if teams are not providing reasonable accommodations, they are by definition not providing disability competent care. Move on to the next slide, please. So what about nurses? We reviewed a little bit of data about physicians. Let's talk about nurses. I mentioned earlier that nurses are often the leaders of interdisciplinary healthcare teams. Nurses, according to the American Association of Colleges of Nursing, make up the largest segment of the healthcare profession. There are approximately 4.7 million registered nurses nationwide. We do know that nurses spend significantly more time with patients than physicians do. So as an example, in the hospital setting, approximately 33% of any given nurse's shift is spent on providing direct patient care. And that's twice as much time as physicians spend with patients. So that's a really important point. And then from the patient perspective, about 86% of patients' contact time in any healthcare setting, so it's almost 90% of that contact time, is with nurses, compared to only spending about 13% of their contact time with a doctor or physician. Lastly, nurses are usually the first and the most continuous point of contact for patients in both inpatient and outpatient healthcare settings. So in any sort of healthcare interaction, you're likely to come across a nurse first who's going to do some of your intake. Nurses are then largely responsible for coordinating your care, regardless of what type of setting you're in. They're also usually responsible for discharge. So among many other critically important roles, it's really that continuous point of contact that makes a nurse's role especially important. And this is particularly true for patients with disabilities requiring accommodations or additional care coordination. So despite all of this information suggesting that nurses are leading and coordinating interdisciplinary care, there are no national data, at least that I'm aware of, that tell us about nurses' knowledge of the ADA and reasonable accommodations, like that physician survey that I presented information from. Next slide. So there seems to historically be less attention paid to the role of nurses in providing care in alignment with patients' legal rights and care that can work toward mitigating disability health inequities. And this is the foundational rationale for the development of the specific training that I'm here to discuss today. There are also other factors that led us down this path. So for example, as I stated in the beginning, there are a lot of disability-related trainings for healthcare providers. However, when looking in greater depth at the available trainings, my team noted that existing disability-related trainings for healthcare providers are either created for a more general audience of providers, and thereby don't specifically address roles and responsibilities of specific providers on an interdisciplinary team. And or B, these trainings might focus on best practices for caring with patients with disabilities without actually addressing the legal foundation underlying many of those best practices. And that's a key point. So when we think about the science of behavior change, the ways we get people to do things that they might not know they need to do, there's a big difference between telling someone that they should do something because it's the right thing to do, or because it's the best practice, or because it's preferred, versus teaching someone about a law on the books that states that they have a legal responsibility for doing that thing. It's very different. And that was another part of the rationale for developing this particular training and really making that direct connection between legal responsibility and best practice. The last major factor that prompted the development of this training was noticing that most existing healthcare provider trainings focused on providers who are already credentialed and practicing in the clinic. Most of the available trainings that my team reviewed provide continuing education units for physicians, nurses, and other disciplines. So those are people who are already working in the clinic, they're treating patients, they're working in their setting. And we noticed a real gap in, there were almost no trainings available that are geared for people who are still in training to become healthcare providers, and specifically in our case, nurses, nursing students. We really wanted to focus in on those who are still completing their training, because embedding this knowledge and embedding these best practices from day one, rather than trying to kind of untrain and retrain people who are already facing patients every day, has the potential to be more effective in the long run. So all of these factors combined together created the rationale for developing a training that addresses disability competent care and the legal requirements for patient care mandated through the Americans with Disabilities Act, and focusing that training on pre-service nurses, so those who are still receiving their nursing education. Next slide. So next I'm going to describe the training development process and how we went through iterative rounds of testing to just really make sure that the training is going to be effective for nursing students and making sure it fills the gaps it needs to fill. Next slide. The development and testing process generally followed 4 steps. So the first thing we did was conduct a needs assessment to identify gaps and determine the real focus of the training content. Based on that needs assessment, we then drafted training module content to address the gaps, and we did that with an interdisciplinary team. That team included our collaborators and funders at the Southeast ADA Center, our project team at the Center for Leadership and Disability, and other partners, including nursing professionals and nurse educators, of course. Third, we recruited subject matter experts to review and provide feedback about the training content and inform its structured delivery. And then fourth, of course, we pilot tested the training with current nursing students and had them provide detailed feedback about the content and formatting. So I will talk more in depth about each of these steps next. Next slide. So again, we began developing this training by conducting a broad needs assessment, and this was back in 2021 and 2022. And we did this with the goal of capturing perspectives of many different types of healthcare providers. So at this point, although I've already sort of reviewed this background information, at this point in the development of the training, we had not yet made the decision to focus on nursing students. So we administered a survey and conducted interviews with healthcare professionals representing a range of health disciplines. However, almost all of the survey respondents and most of the interview respondents were nurses or aligned with the nursing profession. So the slide mentions that 57 people completed that initial survey, and 49 of those were affiliated with the nursing profession, identifying as undergraduate nursing students, registered nurses, nurse practitioners, and 1 doctor of nursing practice. The survey findings mimic the data from that national physician survey that I mentioned already. And the findings really confirmed a lot of what we already knew. Over 80% of the survey respondents indicated that they were either somewhat or not very familiar with the Americans with Disabilities Act law as it relates to their profession. And 86% of the respondents reported never receiving any training on the Americans with Disabilities Act as it relates to compliance in their role or professional discipline. So then we moved on to interviews. Interviewees shared perspectives, further confirming that healthcare providers across disciplines receive no or very little training on the Americans with Disabilities Act law and its relation to their job responsibilities. Interviewees suggested that if we were to develop a training, because that was one of the questions we asked, that it might be challenging to cover this content and make the training relevant to all health disciplines. So interviewees suggested that focusing on providers that spend the most time with patients and families, like nurses, might be most beneficial. So upon hearing that, we began to loop Dr. Patricia Lawrence into our process. So at that time, Dr. Lawrence was a faculty colleague in our university's College of Nursing, and she also has a long career as a clinical nursing provider. So after much discussion with Dr. Lawrence and our team, the Southeast ADA Center, we decided that developing a training that addresses nursing students specifically, and a training that could really be embedded into nursing curricula would be a great place for us to start. And just to reiterate again, we wanted to focus on students because they're still learning, and engaging in a training like this during those pre-service preparation years has the potential to help folks learn comprehensive strategies for caring with patients with disabilities in alignment with legal requirements before they begin working in patient care. Next slide. So to start to begin to develop modules, the first thing we did as a team and in partnership again with our funders at the Southeast ADA Center was to review other available trainings. We reviewed first some of the other trainings that are available through the Southeast ADA Center. And that was important because we really weren't sure if our training would need to cover sort of all of the foundation of the ADA and how it relates to the nursing profession and what the legal requirements are and how that shapes disability competent care. That would be a lot to put in one training. Fortunately, the Southeast ADA Center already provides a Foundations of the ADA course. So at that point, we determined that our training would not need to cover the entirety of sort of basic ADA foundations, and that we would strongly encourage people to take that foundations course before taking our nursing guide to the ADA course. We also reviewed other disability and healthcare provision trainings that we found through an environmental scan because we wanted to see what existing content specifically addressed the nursing discipline. And part of that was to ensure that we could reference good existing content, right? Why reinvent the wheel? We wanted to make sure that we were really filling gaps where we could. We did not want to create a training that replicated an existing training. And lastly, we reviewed and really made sure that we embedded in our training the core competencies on disability for healthcare education. These core competencies were developed by the Alliance for Disability and Healthcare Education in 2019, and they are absolutely critical to this field. So after completing those reviews, again, as kind of an environmental scan process, and feeling like we had a comprehensive sense of what our training needed to address and how we were going to address it, we started to draft module content. And again, we did this with an interdisciplinary team. So people on our team that we engaged in the development and review process have backgrounds in public health, nursing, law, special education, social work, universal design for learning, and other related disciplines. Importantly, we also have people with lived experience who identify as having disabilities and people who identify as family members of people with disabilities on our team. And we drew from all of these perspectives when designing the training content and format. Following that process, we identified external subject matter experts and invited them to participate in the development and review process. So we sent drafted content to these individuals. They provided very in-depth, detailed feedback. They sent it back to us. We made updates. We sent it back to them for a second level of review. They provided more feedback. We embedded that and sort of rinse and repeat until everyone was in agreement that it was ready. So kind of in summary, short version, we followed an iterative process. We involved an interdisciplinary team and really felt that our process was best positioned to promote learning around disability competent care. So next slide. You've probably been sitting there wondering, what is in these training modules? The training consists of 3 modules. The first module is titled Introduction to the ADA in Nursing. It provides an overview of disability rights and a very brief overview of the Americans with Disabilities Act and its 5 titles. The purpose of Module 1 is to introduce nursing students to the ADA and talk about how the ADA protects the rights of individuals with disabilities. Next slide. The second training module is titled Accessibility and Accommodations, and this goes a little bit deeper into ADA Titles 2 and 3, which address healthcare settings. This is really where we cover specific patient care responsibilities as they relate to ADA provisions. The purpose of this module is to review the titles of the ADA, demonstrate important differences between the titles and how accessibility is relevant to legal obligations and responsibilities when caring for patients with disabilities, specifically for nurses. And I want to reiterate here, the nursing guide to the ADA training does not provide a whole overview of the Americans with Disabilities Act, but it does give an overview of all 5 titles, and then in this module goes specifically into titles 2 and 3. Next slide. The last module, Module 3, is titled Effective Communication and Healthcare Competencies. It basically reviews communication strategies, making sure that nurses are aware of best practices because they are typically leaders in patient communication, and that's especially true for patients with disabilities. The purpose of this module is to provide opportunities to demonstrate mastery of respect for patients, recognize optimal health and quality of life from the patient's perspective, and understand and identify plans for accessible communication in all aspects of the healthcare encounter. That includes scheduling, intake, responding to and asking questions, and then providing follow-up care. So those three modules comprise the training. I want to point out there are also several resources embedded or linked in each module, as well as additional resources that are linked and listed at the end of the full training. Again, that foundations, the ADA Foundations course developed by the Southeast ADA Center is linked there as a strongly encouraged prerequisite to these modules. Some examples, and this is just a couple examples of a longer list of resources. We link to the self-guided responsive practice training modules for health professionals that were developed by the UCED at the University of New Hampshire. And those training modules sort of further cover disability competent care strategies, but that training is geared toward a broader sort of span of healthcare professionals. We also have embedded in each module and at the end of the training links to ADA frequently asked question guides. We have guides to developing resources in plain language and other types of things that would really help move anyone who takes this training from knowledge to practice. There's also a pre-test and a post-test that go along with the training, and people have to complete those through the learning management system, which we'll show in a minute. And we have to have those data, right? We want to be able to show that this training is effective, at least in producing knowledge change, and that's how we do that. Next slide. So after we developed and refined the training, we had 8 current nursing students who were enrolled in undergraduate and graduate programs pilot test the training. So they completed the pre-test that we developed to go along with the training. They then worked through the training modules, and then they completed the post-test, just the way anybody would if they were taking the training on their own. We designed a questionnaire to systematically gather the students' feedback and their suggestions. And they were providing feedback, of course, on the content of the training, but also on the flow of the modules, the design, and the accessibility, which is very important. They also provided some feedback to help reshape the pre and post test. In very quick summary, the student feedback that we received indicated that the information that was provided through the training was extremely important and it was novel to them. The information that was provided in the training, as they report, was completely absent from the content provided in their coursework. And then one of the more major pieces of feedback that we heard that led us to make some substantive revisions to the training at that point was that students really wanted more examples of real world approaches to promote deeper learning and, again, help them translate knowledge into skills gain. So we consulted again with our subject matter experts and nursing faculty at our institution at Georgia State to add more case study examples that were aligned with what nurses might see in a typical shift, either in an inpatient or outpatient setting. And we embedded those examples throughout the training. So there are now 2 or more case studies, very in-depth case studies that accompany each module. Next slide. I've talked about this a little bit already, but I want to make it a point to describe how people with disabilities and other disability community stakeholders were involved in the training development. At the Center for Leadership and Disability, much like many UCEDs, nearly every project we have involves the input of people with disabilities and family members during all stages of the project. So from conceptualization to design to implementation to evaluation, all the way through to dissemination. And this project is certainly no exception. People with disabilities and family members of people with disabilities have been involved in several ways. So first, Before we began really doing anything on the project, we shared the idea with our CLD Community Advisory Council, or our CAC, which is a group of people, including people with disabilities, family members, state agency personnel, representatives of community-based organizations, and other stakeholders. And this group of people helps to shape our center's activities and strengthen the relevance of those activities to the disability community. This diverse group of folks provided their initial thoughts about the work that we set out to do, and they provided initial ideas that they would like to see embedded in the training based on their own sort of lived experience perspectives. They've also had the opportunity to access those modules now that the training is live. Secondly, I mentioned that we worked with nursing subject matter experts when developing the module content, and those subject matter experts wear many hats, so to speak. So for example, just as one example, one of the subject matter experts is also a parent of a child with a disability. So she brought that perspective into every stage of module development and refinement. Third and last, at least for the sort of summary that's here on this slide, we also wanted to ensure that there was adequate representation of people with disabilities in the images and videos that are embedded in the training. So we partnered with the Human Development Institute at the University of Kentucky, which is another university center for excellence in developmental disabilities. And we partnered with them to embed healthcare videos that they had already created into our current training. We also feature videos from the Disability Rights Education and Defense Fund, or DREDF, and those videos feature people with disabilities discussing their healthcare experiences from their own perspectives. The link to the Human Development Institute videos is shown here on the slide, and I'll also put it in the chat a little bit later so everyone has it. Next slide. So before the training was finalized, it went through yet another round of final reviews by Southeast ADA Center personnel. And then finally, there was the process of taking all that we had developed, which was actually still in the form of PowerPoint files and attached resources, and getting all of that onto the Southeast ADA Center's learning management platform. And that was a heavy lift that, of course, was completed by Southeast ADA Center personnel. I want to point out that one of the shared goals of CLD and the Southeast ADA Center is, of course, to make sure that anything that we're working on, including this training, is as accessible as possible to as many people as possible. So the Southeast ADA Center has a learning management platform that prioritizes accessibility. And they also have extremely knowledgeable staff that understand how to promote accessible and widespread use. Next slide. So without further ado, it's time for the big reveal. The nursing guide to the ADA training is now live on the Southeast ADA Center Learning Management Platform. The link to the training is shown on the slide here. The shortened link is bit.ly/nursing-ada-course. And I will now put this link into the chat box as well so that everyone has that. And if we go on to the next slide, there's also a QR code that you can scan now using a mobile device. We will make sure that everyone here, if you want it, you can get the link, you can get the QR code. I also have a slide, the last slide of my presentation has my contact information on it. So you can certainly reach out to me, email me for access to the training. Next slide. So of course, over time, I would love to see this training embedded in every single nursing program in the United States and beyond, right? I also know that getting there would take a while. Our initial dissemination plans for the training include dissemination through the Southeast ADA Center, of course, and through the ADA National Network, which I'm doing a little bit of right now by giving this webinar. We've also begun some targeted dissemination, including outreach to all accredited nursing programs in the state of Georgia, outreach to our University Center for Excellence in Developmental Disabilities partners in our region, and outreach to our Leadership Education in Neurodevelopmental and Related Disabilities programs, or LEND programs, in our region. And just a note, when I say region, I'm referring to the US Department of Health and Human Services Region 4, which includes the 8 states of Kentucky, Tennessee, Mississippi, Alabama, Florida, Georgia, North Carolina, and South Carolina. Another dissemination strategy that is not listed here, but that I just want to mention briefly, is that we're working with a nursing faculty champion within our own institution at Georgia State University to have this training embedded into at least one nursing course syllabus for academic year 2026-2027, which will begin in August of this year. We're really interested in promoting the sustainability of this training, and I'm really interested in creating sort of an entire generation of Georgia State University trained nurses who exhibit expertise in disability competent care strategies and have deep knowledge of their legal responsibilities to care for patients with disabilities. So once we learn more about how to go about this process of embedding the training into a nursing course, at least one nursing course, we hope to expand broadly to our university system and beyond. This training went live, I believe, in November of 2025, and we've had 42 total learners access the training to date. Our data since the beginning of 2026 are shown on the slide. So we had 7 learners in January and 1 was a completed learner, 7 learners in February with 3 completions, and 7 learners in March with 1 completion. Obviously, we are looking forward to boosting those numbers and just really making sure this gets out to as many folks as possible. So to do that, here comes the part where you have to do work. We want to ask for your help. Next slide. So you've now learned about the training. You're pretty much an expert in this training now. Hopefully you have the link, and we're happy to share the flyer that we created that we're sending out in our sort of dissemination efforts. So my ask of you today is to share the link or the flyer with relevant people and partners in your work. So if you work at a college or university, go ahead and share this information with someone in your nursing college or nursing department. There's at least one USED in every state and US territory, and there are 60 LEND programs across the country. So if you're a person here today and you are connected with your USED or LEND, please share this with them. If you work at or have connections with teaching hospitals or other care clinics where nursing students are completing clinical rotations, please share it there. Sharing this training has the potential to really impact the way that care is provided for patients with disabilities and ultimately make for a better informed and legally responsible nursing profession. So with that, that sort of marks the end of my formal presentation. I have a few additional slides with references on them. And again, my contact information is on the last slide, so we'll put that up eventually. But with that, I'm happy to take comments, suggestions, and questions. And if you didn't come with questions, I have some for the audience. Ha ha. So thank you. I'm going to take a drink of water, and I'm happy to take questions after that.
Well, Erin, thank you so much for sharing this course with us and all of the relevant information. We do have a couple of questions. One is, can you go back to the pilot testing part and tell us how many students pilot tested the course?
Yes, there were 8 students that pilot tested the course. So they were very involved. And it wasn't just a one-time deal. We did an initial pilot test, and then we embedded some of their feedback, and then they took it again. So it was a small number, but a very in-depth pilot test.
Okay. And you've also got several people in the comments area just letting you know that they have connections for you. So they will be following up with you, and we'll make sure that they have your contact information. And thank you. It was just put up here on the slides. And that is EVINOSKI@gsu.edu. And the phone number is 404-413-9331. So And we have another question. It says, what continuing education units can registered nurses receive for completing these training modules, or what besides the certificate will encourage nurses and nursing students to obtain the training and complete the modules?
Yeah, that's a great couple of questions. So, there are no specific CEUs that are sort of pre-approved for this training. When you complete the training, you will get a certificate of completion, and then you can submit that to a relevant, accredited body that provides CEU. So that would be the responsibility of the person taking the training. So I think that was answer to part one of that question. The second part of your question is a great question. So, what besides the certificate will encourage nurses and nursing students to obtain the training and complete these modules? My first initial answer to that is I would love to know more about how to make people do things that they don't know they need to do. Some of the things that I think will help. So two things. The first is what I already talked about in terms of embedding this into an actual nursing course. So to not make it, it's important that it's on the Southeast ADA Center website. So for people who are looking for this type of information, they'll find it there, and that's great. But embedding it within coursework makes it mandatory, right? And that's what I want to see. I want to see that this is a training that's actually considered so important that it is made mandatory for nursing students. My other answer is related to COVID-19. So I think that as more healthcare providers and especially nurses are seeing the effects of long COVID, it will be harder for healthcare providers to ignore disability. That's sort of my perspective based on years in the field. And so while obviously the long-term effects of the COVID-19 pandemic are devastating, I do think that additional attention will be paid to the disabling effects of long COVID, and it will actually force healthcare providers to have to understand these concepts better.
Thank you, Erin. So, and we've got a couple of very good questions here. One is, does the training cost anything for nurses?
It does not. This training is completely free.
Uh, and the next question is, what is the average length of each module? So how long would it take for a person to complete the course?
That is a good question, and it has been a while since I went through them. I think that it's like 30 to 45 minutes, maybe closer to an hour now that we put the case studies in there for each module. So let's say 3 hours total, I think is correct, but I should check on that and get back to you as well.
So, and we have another excellent question. It says, I'm a disability advocate. What's the best way to connect with local hospitals to collaborate on how to improve interaction between staff and patients with disabilities?
Yeah, I think in response to this question, something that I always say is to find your local resources. And because I represent a University Center for Excellence in Developmental Disabilities, I'm going to say find your USED. Your USED may already have those connections with folks who are working in the hospital or other clinical settings. And your work as a disability advocate can help strengthen that relationship and sort of just make the connection a little bit deeper to the point that folks in the clinical setting are seeking knowledge and expertise from disability advocates and people who work at USEDS or in LEND programs. Also find your ADA National Network state affiliate, right? Again, these are people who have a whole lot of knowledge and tremendous connections to other entities, including hospitals and clinical settings. So if you are an individual advocate and you're interested in sort of like, how do I get in the door at a major hospital system? Sometimes it can be really challenging. So I say, find the people who already have that in and get with them.
And in addition to those resources, you may be interested in connecting with your Center for Independent Living, because many centers for independent living are working in this area now and may be interested in helping you. So, another question that we have is, uh, it says, I work in the healthcare system, and one of the biggest pushbacks is training and education due to timing and shortage. Is there a better approach to providing training on the go, such as cheat sheets or different types of tools to ensure nurses and providers get the support on the job?
That's a great question. One thing that I'm working on with my team at CLD that it's totally separate from this initiative, and a person she's a project manager with me, but she was also a student at the time that she developed this resource. She developed a toolkit, so a clinical toolkit. This particular toolkit is actually specific for the emergency department, but I could see, it having utility in other settings where instead of participating in the training, folks who are already working in the emergency department have access to this binder packet of things that are like the quick and dirty, like you're talking about a cheat sheet, quick and dirty tools. It has a communication board in there. It has social stories about getting an IV and things like that that might occur in the emergency department. I think that's a really promising practice that you're saying can sort of, I hate to say skip over the training piece because it's really important, but if we think they're not going to do it, then we have to figure something else out, right? So I would look into the availability of other toolkits that are appropriate for different settings because I think that's sort of an up and coming process. The other thing I want to point out is that that's yet another reason why making sure that we give this type of training to people who are already in their education process instead of letting them go through their education, becoming practicing nurses, and then finding out that they missed a whole bunch of training that they really needed, right? We want to get this as part of the curriculum so that it's not an extra thing. It's already baked into what they, must do to receive their certifications.
All right, another question that we have, and I think you're going to really like this one. It says, do you think this course would be helpful for nurses in the correctional setting? If so, how do you think, or what do you think would be the challenges or benefits?
That is a great question. I will start off by saying I'm certainly not an expert in terms of best practice in correctional settings. So what I'm saying is sort of only my opinion. I think that in correctional settings, as far as I'm aware, we tend to see a lot of folks with disabilities, whether diagnosed or undiagnosed, including mental health disability. So yes, resounding yes, I do think that this training would be appropriate for nurses who are working in the correctional sort of setting. I also think that this training, and this speaks more to sort of my overall values and approaches, I think this training would be good for any nurse practicing anywhere, because oftentimes we think about, people with disabilities are this one population and we're just thinking about this one population, but better patient communication, understanding legal responsibility, those are principles that go outside of the population of people with disabilities and could really improve sort of just patient-centered care more generally.
And Erin, we've got several questions here. I'm going to try and condense them into one, and we've addressed it a little bit, but some of it is, just the fact that there are some medical schools or hospitals that are providing training now around working with and interacting and communicating with either nursing schools or interacting and communicating with people with disabilities. And so they're really trying to figure out how do you make those connections? And, is there anything that our folks on the line here can do to help make those connections with you?
Yeah, I mean, if you're someone who's in attendance today and you're aware of somewhere, that's close to you or that you know of for some other reason who is interested in doing this work, who's already doing this work, please reach out to me because I would love to get in touch with folks and we could partner and do it together, to try to reach out and say, hey, we have this resource, it's free, it's relatively quick. We're not asking for 2.5 days worth of training, right? I would love to partner with you to try to help infuse this into all possible settings. So please reach out to me, use my contact information on the screen, or just find us at the Center for Leadership and Disability, and you can't miss me at CLB. Excuse Excuse me.
All right, we have a comment that I think is actually a couple of comments that I think are very important. One is that the current hospital says they've created a disability competency care learning module, but they're thinking about micro learnings designed for different areas in acute care settings. And then another person says, as someone who ran a health program in a prison system for a decade, all RNs and corrections need this training for sure. So
Yes.
that's good feedback from our folks who are on the ground.
Yes, yes. And this is all, I'm watching the feedback come in and I'm really excited about all of these potential connections that you're all sharing. So thank you so much. Seriously. We put a
Yeah.
lot of work and a lot of years into really making sure that this training was developed in a way that it needed to be so that it really, moves us forward. And so to see that there are already so many folks who want to be able to share this it makes me very happy and my team will be very excited. So thank you.
And I'm going to answer a question here. It says, can you share the training with attendees to this webinar to see if it aligns with our institution's policies and procedures? You will be getting a copy of the slides, and in that is a link to the course. And Gabe, if I can ask you, and thank you, Erin, you just did it, put the link to the course in the chat area. And so you'll be able to get it either from the slides or click on it from the chat area and get to it today. Do we have any other questions or comments? All right, at this point in time, it looks like most of our questions have been answered. And and if you do have additional questions, again, please feel free to contact Erin via email or at her phone number. And or you can contact your regional ADA center if you've got questions about the ADA and nursing. So now you will receive an email with a link to the online session evaluation. We do encourage you to complete the evaluation for today's program, as we do value your input. And we want to thank Erin again today for sharing her time and knowledge with us. And we thank you for attending today's session. We wish you a great day.